I want to welcome the panellists and thank you again for agreeing to be part of this. The title of the panel is Embracing Hope, Navigating Life with Pulmonary Fibrosis, Interstitial Lung Disease. And I'd like to extend a warm welcome to our esteemed panellists who are with us. We're really grateful to have each of you here to share your insights and experience. I'd like to just start, if you can just do a quick introduction, and then I'll start off with a question for each of you. So, yeah.
Hi, I'm Marcia Hooper. I'm a consumer. That means I've got this disease. So I think I was diagnosed in 2017 after about 4 years of coffee. So.
Hi, I'm Karen Simons. I'm the ILD nurse specialist at the Alfred Hospital in Melbourne. I work with Associate Professor Ian Glaspole. I run our MDT and our outpatient service and triage all our new referrals. I'm very involved in the clinical trial side of things as well. We do a lot of investigator-driven and a lot of pharma trials at the Alfred. Very much believe in getting onto new therapies and being involved in research. It's very rewarding as a patient. And yeah, happy to take any questions as we move along.
I'm Deb Sandford. I'm a clinical psychologist and I'm married to a respiratory specialist. But that's not how I got into this. I was sent a patient to speak to who'd just undergone a transplant, and he'd been an absolute, CEO of a company and had been a elite athlete in his younger years. And he said to me, Deb, I needed to see you before my transplant. I was terrified. And he said, I couldn't say anything because everyone always saw me as really tough. And he said, I had IPF, and I thought, what the heck is that? And then I met Paul and the Lung Foundation and TSANZ, and now I know what IPF is. And I've spoken to lots of patients, and I wanted to do some more research on the psychological impact of IPF. And so I started a PhD, which hopefully I'll finish next year, and that looks at the psychological impact of IPF on patient and their caregivers. And hopefully next year we'll be delivering an ACT-based 6-week group, a bit like pulmonary rehab, but for your brain and heart. Well, your feeling heart, not your pumping heart.
Hello everyone, I'm Anthula Mohammed Ali. I'm Head of Department of Palliative and Supportive Care at RPA. So my interest actually stemmed many years ago into managing breathlessness in advanced disease, and that was triggered by my work in Aboriginal communities actually. I worked in the Northern Territory for 4 years in paediatric and adult palliative care, came back to New South Wales, ended up at RPA, and I run a clinic fortnightly alongside Tamara Corti and her team.
Amanda Howe. I diagnosed with ILD in 2020, went downhill quite a bit last year, and was fortunate enough to receive a transplant in January this year. So going well.
I'm Ted Moore. I've had this disease since about 2018. I've realised it comes in so many different guises. Mine's called hypersensitive pneumonitis. Seems to be associated with birds, but really, I think the link is genetic. My father died of sarcoidosis. So I guess my concern is as to the future, what cards using Lisa's demonstration I've passed on to my children, always a concern.
Wonderful, thank you very much. I'd like to start with the consumers on our panel, and as per the topic that we've chosen, which is embracing hope, if you could please share with us what that means for you, particularly in the more challenging times. How do you do that?
Where do I start? Look, I think first and foremost, I was very fortunate to have beautiful family and friends. Without them, I don't know what I would have done. And hearing a lot today resonates. The gentleman that Deb has worked with, very similar. I wasn't, different field of work, but my life just changed. And I think, can't remember who said it, I think it might have been the first presenter, talked about the specialist or your physician just being up front, and I appreciate that. But I'll never forget when I was my very first appointment, and he said, your life's going to change. It will be very different. And I sort of thought, okay, whatever. But yeah, I haven't worked since my diagnosis. I was hospitalised, and long story. So, going from a very busy working life, working mother, working everything, to patient and having to depend on people, that was probably my biggest adjustment mentally, physically, and everything. And embracing hope, as I said, the family and friends that got it, a lot didn't, and knowing who to talk to and share with, then professionally seeking out help. But constantly talking. I do talk a lot, but being able to talk about it so you can get a realistic perspective back, is probably one of my biggest suggestions.
Wonderful. Thanks, Amanda. And because Ted's closest to you, if you don't mind, Ted.
Look, I suppose for me, I've been relatively lucky in the sense that although my lung capacity has declined over time, I'm still able to do the sorts of things that, I think at my age of 82, not that far removed from what perhaps I'd have done if I'd been fully okay. I try to keep up exercise. I think that's been a key feature of this morning's talk. I try to be active, but I note I'm not walking 30 minutes a day, so I'm going to have to do that. Look, at times, things do get on top of you when you try, in my case, to sort of climb those hills. You really do come to a bit of a halt, and at times this condition does remind you that it's impairing your way of life, and at occasions it does tend to get you down. Like Amanda, though, I have strong family support, and I have a lot of activities which I think distract me from overly focusing on my own condition, which I think is an important thing. Whatever else you need to do, you need to have a focus which turns you out rather than in my view. So those are the things I think are important.
Thank you, Mr. Yep, great, thank you.
That seemed to come through, that you really need to have that confidence in who's talking to you about what should happen next and what your lifestyle decisions should be. Family's super important. They're great at distractions. Friends are great. I've got some really good friends who are really great at a hug or total distraction, or, being a sounding board if I need that too. So all of those things, staying active, all of those things will help. So.
Fantastic, thank you. And before we open it up to questions, I just want to get the perspective of the healthcare team from your various roles and how you work with your patients. What is the advice you give, or how do you work with patients around this area of maintaining hope?
I think it's really important to maintain hope. If we look at how long I've been working in interstitial lung disease, in 2008, we didn't have any therapies then, like treatment was a transplant. Now we've got the antifibrotic therapies, the pirfenidone and the nintedanib, which slow down progression of the scarring of the lungs. And there are so many new agents in the pipeline, so many pharmaceutical companies investing so much money trying to find medications that are going to slow progression further, stop it completely. So I think it's maintaining hope is really important. To be positive, to get out and about and do things that you enjoy, spend time with your family. I think pulmonary rehab's a great thing for everyone to do if they haven't done it already. And of course, like the Lung Foundation have so many great resources online that you can have a look at. Getting involved in clinical trials, when you're in a trial, you come and see the team, the nurses and the doctor a lot more often than you would your normal appointments. So you're really being monitored really closely, lung function all the time. And, we can pick up, if things aren't going well and you've just got someone to talk to. I think like the trial nurse kind of becomes your new best friend. They're there to listen to you and advise you, maintaining all your vaccinations as well. I think it's really important. You don't want to get an infection, 'cause sometimes you can go down that slippery slope. If your grandchildren have got coughs or sniffles, maybe try to avoid them so that you keep at the best health that you can be. And I think also another good thing that the Lung Foundation offer is the peer support group, to talk to other people that have got the same condition as you. It can often be really helpful, and I know, I had a group in Melbourne and they called themselves the Bung Lung Group, and they used to go out for lunch. I'm sure they just used to gossip about me. But, and they all really enjoyed that and, became really good friends, and just to share their stories with each other. Be hopeful. I think that we are going to see lots of more medications come out that are going to slow progression, and I believe that with all of the pharmaceutical clinical trials going on. So be hopeful and be positive. It's really important.
Thank you very much, Karen. And just to mention, so from pulmonary rehab and peer support programs, if you are struggling to find the pulmonary rehab program that is closest to you, if you go to the Lung Foundation website, we do have a service directory that has the pulmonary rehab groups that you can access. And also our 1-800 number, our staff on that inquiries line can also connect you with those pulmonary rehab programs. So thanks, Karen. And over to you, Deb.
Well, hope is sort of my trade. I think it is important to try and stay positive, but I also think the flip side of that is equally important, that when we are having a low energy day or a day when we are feeling less positive, they are also important to be able to validate our right to actually feel like that, and we find that, when you get diagnosed and at different times throughout your disease, you're going to grieve. You're going to grieve for the life you've lost, you're going to grieve for the life that you might have had. And your partner and your family will also do that stuff. And, so I think it's really important that we allow ourselves to experience the full gamut of emotions that we are given, and not think, oh, I have to be happy and I have to put on this brave face for my family. It's okay to say, I'm having a really tough time today or this morning. And the other part is we can limit. In our brain, our self-talk, we all have self-talk, and we can say, if you wake up feeling a bit, you can say, well, maybe once I've had a shower or once I've had some breakfast, I might feel a bit better. So I call it building in wriggle room into our self-talk and what we say, and so if you wake up and you say, I'm having a bad day, there goes the day. It's done. It's a bad day. But if you sort of say, oh, I'm having a low energy morning, then it might be that by lunchtime you feel a little bit better. And you might not, but you can keep giving yourself sort of mental opportunities, And the other part is that I really encourage people to expand their emotional vocabulary. We don't want to dumb it down. We don't want to just say, I'm anxious or I'm depressed. That's sort of umbrella terms. It's a bit like ILD as an umbrella term or PF as an umbrella term. We want to be able to more accurately describe how we are feeling. And that, again, gives us hope. It builds that hope in when we are allowed, and we allow ourselves and our family and friends allow us to be human.
Fantastic, Deb. I think there's a great saying that says, worrying about tomorrow doesn't make tomorrow any better. It just makes today worse. So, and I think, and the practical way that you approach how people can start to change that perspective, fantastic. Anthula?
Can you repeat the question?
Sorry. No, sorry, yes, yeah. It's really, it's around that topic of hope. And how do you work with your patients? What are sort of some of the things, advice that you provide around that whole area, particularly during the challenging time?
Thank you. So I think it's just, so similarly, hope is very much bread and butter in palliative and supportive care. If we define hope, and it's important to define it because if we don't define it, how do we know that we're making a difference? And that there are several elements to hope, but it's an uncertain expectation. So it's actually acknowledging the uncertainty that people are living with. No one's got guarantees for any of us, but particularly when you have a really serious illness. And it's not just the person, their family are living with uncertainty as well. So it's this uncertain expectation of a future good that's both personally significant and realistically possible. And I think you sort of touched on the reality of things.
That future good could be a good death. You know, because that's the other thing that we need to talk more about is death and dying, and how do we want that to look for all of us, not just people with ILD, because you know, our family are also imagining that, and if we don't talk about it, then sometimes the imagining is worse than the reality of that conversation. And tears are okay.
I'm so relieved I wasn't the one to say the dying word, because we get stigmatised with that. But when you ask me what advice do I give patients, I don't give them advice, I sit there and listen, because if we go back to hope, it's what's personally significant. So tell me what you're thinking, tell me what you need, tell me where the information gaps are. So a lot of our initial consultations are around listening to the illness narrative, the life story, the richness of what brought you here, who's in the family, what's important to you, because then we can then anchor on to what, you know, hope means for people. And it can mean different things to different people. For many, it is the hope that we will get to mRNA technology very, very quickly and reverse aging, not just in our lungs, but in our skin as well. But the you know, the other end of the spectrum is around what will end of life look like for all of us. And it's particularly significant in the people who have very strong family histories, or they've been very close to someone who has died a respiratory death. So answering your question very simply, what's the advice? I don't try not to give advice, I try to listen and hear exactly what is it that you need from palliative and supportive care.
Thanks, Anthula. Not sure if questions have been coming through as our panellists have been talking, so I think we've got one online. For Amanda, how did you make the decision to stop working? The person who's asked the question is 49, rapidly going downhill with ILD. Advice to me was to continue working in some way as long as possible.
Yes, it wasn't a decision. It was basically I couldn't, with the medication and combination of the disease and how quickly it was progressing, more the side effects of the medication. I like to blame that rather than the disease. Just, you know, and the symptoms are up on one of the slides, all of them I ticked except for losing weight. I did the opposite. But the tiredness, exhaustion, and massive brain fog, which I still have, so the lung transplant hasn't helped with that yet. But again, it's side effects of a lot of the medication, and you know, specialists were fantastic, but we were constantly changing the meds to try and, you know, beat the rapidness of the disease. So yeah, it was pretty much just my symptoms that caused inability to, you know, my work involved a lot of travelling and things like that. So
great, thanks, Amanda. Were there any questions in the audience? Got Alison waiting with a mic for anybody? Yep. Yeah, absolutely. Yeah.
So people ask me that quite a bit about when do I stop work or whatever. And again, it comes back to what Athula was saying about definition. What does work mean for you? And, you know, if your meds make you a little bit unpredictable, then maybe volunteering might be a way you can still get out in the community, feel useful, feel like you're contributing, but volunteers have a slightly bit more wriggle room. You know, like if you can't come in today, you ring up and you go, look, it's not a good day. You know, and so you might volunteer at the local op shop and do half a day, do a morning. And you might do that once or twice a week, or you might volunteer on, you know, something that's more dear to your heart, you know, with the Lung Foundation and the consumer advisories, or where you can do it online from home. So work can look different if the financial considerations is not you know, something that we have to factor in. But how do you keep that feeling of being productive from going to work?
Yeah, absolutely, Ted. Yep.
I was just going to say that amongst the wealth of material we've heard this morning, one thing I was struck by was the absolute depth of material which is available to us all through Lung Foundation and the various websites. I think there's an enormous amount of information there which must improve our knowledge. There's lots of support, and I think that is a resource which I was really not aware of, and I think offers a lot of hope and support, you know, for all of us if we take advantage of it. I'm certainly going to try.
Wonderful. Thanks, Ted. There's a question. Yep.
Yeah, before today, I seen palliative care as an end of life, but I guess you're saying now maybe it's a bit more of supportive. When do you know when the right timing is for that?
Yeah, thank you. It's a question we hear all the time, not just in interstitial lung disease, but in all our people who are living with illness that impacts on their quality of life. So, you know, 30 years ago or so, it was all about the timing and prognosis, but the science has shown us, the research has shown us actually the later that we're involved, palliative and supportive care, the less difference we make. So it's not about the timing, it's about needs. And so it's specifically looking at what needs, you know, you or your loved one has. So is it around physical symptom needs, you know, particularly cough? So it's interesting that we talk about breathlessness, and I have an interest in breathlessness, but the two things that bring people to the clinic that I sit in is I need more information about what the future looks like, and how can you help me with my cough? So it's really needs-based. The other thing is the model of care, and it will vary depending on what the resources are that you have, where you know, everyone in the room and online lives, is that we have the model of care where we meet needs. We may dip into a patient's life, we'll address whatever their needs are, physical, social, psychological, existential, spiritual. We'll provide, you know, advice, suggestions, resources, and then we'll dip out. We might not be needed again. We may never be needed again, or we may need to dip in and out until it gets to the point where the person is heading towards the very final part of their lives. So I guess, you know, it depends on the resources that you have available to you, but I would frame it in terms of what the person needs rather than a time point or a lung function, an FVC or an FEV1 or a DLCO. Yeah.
Great, thank you. And this will be our final question. Thank you.
Being an old teacher, my voice is loud enough to carry with that anyway, probably. But anyway, I'm just going to give a little bit of advice to everybody. You know, if you're having trouble getting exercise, get a dog. When the dog stares at you all day with those big brown eyes until you feel so guilty you just got to go out and get exercise. And then when you get out there, the dog's so happy it cheers you up as well. So you win on 2 counts.
I'll give you a personal story. So my mother-in-law has interstitial lung disease, coincidentally, and she refused to get a 4-wheel walker, so she's 80 next year. And ultimately, the reason that she accepted a 4-wheel walker was that it was a way to actually carry the dog on. She's got a little dog. Because the little dog can't walk very far and is probably biologically as aged as my mother-in-law. So absolutely, I agree, get a dog.
I had one little question I was going to ask Marcia. I was talking to Marcia earlier about, we were both comparing notes on our effects of the drugs and whatever. And Marcia passed on a good bit of advice to me, which I think she should probably share with everyone. I'm putting her on the spot now because she didn't want to do it. Now you've got to, Marcia.
Thanks, Bob. Yes, I think, I can't remember who was talking about it. My specialist actually found a Spanish trial talking about the effect of diarrhea from nintedanib and pirfenidone. And he found carob powder or carob flour, either name seems to be interchangeable, works just as well as GastroStop without any side effects. So for the last couple of months, I have enjoyed a better lifestyle than I have for the 7 years prior to that. So I'm hoping to be able to go back to full strength pirfenidone, nintedanib, sorry, full strength nintedanib from that. So if you're having those side effects, you can get them online, a carob flour or carob powder, and I just add mine to my cereal or my oats or whatever in the morning. It's not a great taste, but it seems to work well. And honestly, if it helps, it might improve your life. It certainly helped improve mine. So.
Great, thanks much. And I think that is what you just demonstrated is why peer support groups can be so important for people, because it is an opportunity to talk about what works for you. It should never take away from seeking support. I'm sounding like a broken record here. Always have a chat with your medical team before you make any changes. But, it is about communication, and it is about you feeling confident to be able to communicate what's important to you, what your expectations look like about your healthcare, how you establish those really good relationships with your healthcare providers and your healthcare team. We know from the work that we do with consumers and the insights we gain that can make a significant difference to your confidence, your sense of well-being. Having those conversations is really important. So thank you to our panellists, and we will be wrapping up the morning session. I hope you've gained some really great insights from the very experienced speakers that we've had. Personally, from the Lung Foundation Australia, I want to thank Tara, who's really helped in organising this event with me, and also the support that we've had from the Centre for Research Excellence, so from Alison and Bonnie today as well. Thank you. And please, if you ever need information, there are lots, as Ted rightly said, there are lots of opportunities to find that information. If you get stuck at all and you don't know where to start, as the Lung Foundation is a great place to start. And we have that 1-800 number, which is a free call, and you get to speak to a person who'll be able to help you navigate what that question looks like, and point you in the right direction. Because we know sometimes it's not about services not being out there, but actually you being aware of what's out there and how you can be better connected to them. So thank you all, and enjoy the rest of the day. Thank you. Thank you.